So good afternoon. We shall be taking you through the National Emergency Response Committee on Coronavirus, an update on the current country response measures as at 21st April 2020. This is day 40 of our country's response, and this is our 35th brief. Fellow Kenyans, coronavirus has continued to cause distraction in every part of the world. As of today, the global COVID-19 pandemic cases stand in excess of 2.5 million, with approximately 600,000 recoveries and 170,000 deaths. Here at home, the numbers have been rising every day. Even in these times, we still have cynical Kenyans who hold the view that this disease is not real. This is very disturbing, particularly in light of the growing numbers of people who are infected. As we continue this fight, we note that there are some of us who continue to disobey the measures and regulations announced by the government. I would like to remind you that we are in a war situation against an enemy that is not a respecter of age, status, gender, race, and religion. Some of our young people are deliberately breaking curfew regulations due to the false belief that they cannot catch this disease. And we would like to remind you young people, including myself, that we are actually able and susceptible to get this disease. In the early days, we cautioned you on surfaces that are likely to be contaminated in the aid of the transmission of this virus. Among such surfaces include groceries in supermarkets. We would like to acknowledge efforts made by many outlet stores by providing sanitizers to shoppers and ensuring that no shopper is allowed into a shop without wearing a face mask. However, we are concerned that it is important that cashiers handle the goods correctly, especially during payment at the counters. These are also areas that can be easily contaminated and that can lead to infections. And therefore, we are urging all supermarkets to devise innovative ways to address this issue. The same should also apply to banks, particularly in the aspect of different people sharing pens in the banking halls. Fellow Kenyans, this is a long journey that we cannot walk alone, and I want to thank all the individuals and corporates who have so far contributed to this containment effort. I particularly want to thank the Kenya Air Force for deploying 2 aircrafts that have been flying banners, aiding in our communication with banners stating that we should stay at home. I would also like to thank our healthcare workers for their continued efforts, and particularly today, where the Kenya Editors Guild Association, together with the Kenya Medical Association and the Association of Nurses, has initiated a campaign dubbed Saa Sita. In this campaign, at midday every Wednesday, we will all stop and clap for all our healthcare workers. And this is a campaign that is being rolled out in different countries across the world. This is to appreciate the role of healthcare workers and the crucial role that they are playing in this time of COVID-19. Let me also acknowledge the contribution of mobile network providers, and in particular, our national carrier Safaricom. Through its foundation and other donations that have come so far, they've contributed close to 10 million Kenya shillings for thermal scanners, and they've also helped us in expanding our screening capability. Additionally, Safaricom will be supporting healthcare workers and is in the process of rolling out a free communication package. This package will include 3 months of internet bundles and airtime for our healthcare workers and will form part of the comprehensive care package for our healthcare workers. Yesterday, we mentioned to you that the strategy that has been formulated and agreed upon globally as the most effective way of fighting this disease rests on 4 pillars. That is, testing, isolating, treating, and tracing. We have ramped up our capacity in all these 4 pillars. However, these parameters only become useful when preventive measures are put in place, such as hand washing, social distancing, general hygiene, and quarantine. And therefore, the only way we can succeed is when we have each and every one of us taking personal responsibility. I therefore would like to urge all our people to continue observing these simple but very effective containment measures. Today, our coronavirus situation is as follows. In the last 24 hours, we have tested 545 samples, out of which 15 persons have tested positive for coronavirus disease. This brings to the number 296 total number of confirmed cases in the country. 11 are Kenyans, while 4 are foreign nationals. And out of the 15 positive cases, 7 are from Mombasa, 6 from Nairobi, and 2 from Mandera County. None have any history of recent travel. With regard to gender, 7 are males, 8 are females. The 15 are aged between 19 to 75 years of age. 6 are from our quarantine centers, and 9 were picked up by our surveillance teams. And this is a clear indication that the infection is increasingly growing within our communities. And it is therefore very critical that we observe very strictly the measures that we've put in place with regard to containment. I am glad to inform you that 5 patients have recovered and discharged. We now have a total of 74 recoveries. A total of 2,851 contacts have been monitored, out of which 2,121 have been discharged. 730 contacts are being followed up at the moment, and a total of 14,417 samples have been tested so far. I thank you. Thank you. Thank you for those questions. I'll begin with Nancy's question. This is a question that we actually discussed yesterday. Indeed, as a country with expanded lab capacity, we do have many more labs that are able to test. However, we are facing a challenge with regards to some of the sample kits, the nasopharyngeal swabs and oropharyngeal swabs that are utilized for taking of samples. And therefore, that is why you're seeing our numbers in terms of samples tested reducing. We have, however, engaged our supply chains to be able to avail these samples so that we can ramp up our testing capacity. An important issue that has been raised, indeed, it's true, we are seeing an increase in cases in Mombasa. Yesterday, we recorded 7 cases. Today, again, we've highlighted a new increase in number of cases. And this is exactly pointing out to the fact that we have established local transmission of this virus. And therefore, communities do need to take charge. Some of the measures that we've been putting in place, we've noticed, may not be well adhered to by members of the public. And the only way, and we've insisted and reiterated, the only way we can flatten this curve is if we each take personal responsibility in doing this. And I'll relate this to the issue of curfew. Curfew is not there because it's trying to punish Kenyans, but curfew is a mechanism of containment for this virus. And so again, we do request Kenyans to adhere to these restrictions and to obey the rules. And for those who are flouting the rules, it's important that you understand, even by the very nature of you flouting the rules, you're putting your own life at risk, that of your family, that of your loved ones, and that of the police who are here to assist us in this response. We are engaging with our security personnel, one, to roll out guidelines for them and capacity building that enables them, one, to ensure that they are all masked every time they're conducting their surveillance activities, that they are using masks, and that they're also practicing hand hygiene, and that they also have sanitizers. Again, it is important to note that we are all in this together. We are all employing a whole of government approach, and we expect citizens to take personal responsibility as we try and effect the containment of COVID-19. Indeed, we've received reports from KMTC. We saw the news circulating through social media, and we've activated channels through the Ministry of Interior, who are following up on this issue, and we'll be able to update you once all the information is collected and the investigations are undertaken.